start by having you state your first and last name and then the correct spelling of it and your title.
Okay, my name is Shawn Penn, SHAWNPENN, veterinarian at Southwood Drive Animal Clinic.
Okay.
Okay.
And my first question is breast cancer, and whether it's cats or dogs. Would you say it's mostly female cats and dogs, or does it go equal both ways?
Okay. Breast cancer can occur in either male or female dogs and cats, but it is primarily and most commonly in the female dogs and cats, strictly related to the hormone estrogen that is produced by the female. It is one of the more common tumors that we see in dogs and cats, especially those that are older and those that are unspayed. So the intact females, as they age, and it's most commonly usually between 9 to 11 or 12 years old, in older animals, both dogs and cats.
Okay, and is it correct that it's 50% of the female animals or dogs are unspayed? I don't know if you know any of those statistics.
I don't know any of those statistics specifically. Okay. I think that's going to differ depending on your demographics, where you're talking about, rural areas versus cities. That's gonna differ. I don't know any specifics on that.
Okay. Well, speaking of rural or city areas, would you say more so city areas versus rural, or what would you say the difference?
I'd have to be speculating, but I would expect that probably there are more unspayed female animals in the rural areas, but as opposed to in the city or urban areas. And certainly those are the animals that are going to be at more risk for developing memory tumors, memory cancer. Yeah.
And as for those tumors and things, what are some of those leading causes?
Okay, so being unspayed is the primary cause. It has been shown that these tumors are easily prevented by spaying dogs and cats at an early age. It's been found that if a dog goes through multiple heat cycles or estrus cycles, that increases their chances of developing memory tumors at a later age, to the point that a dog who is beyond, goes through at least 2 heat cycles, has a 1 in 4 chance of developing memory tumors at a later age, as opposed to dogs that are spayed at less than 2 heat cycles, or at an early age, less than 2 years or so, has less than a 10% chance of developing those tumors. So as dogs age and experiences more heat cycles or estrus cycles, the chances of memory tumor development at an older age greatly increases. So prevention is the main goal, and that can be done by spaying dogs and cats both at an early age. Cats that are spayed at less than a year of age has significantly decreased chance of developing memory tumors when they're older. Whereas cats that go through multiple heat cycles or are beyond 2 years of age, there's really no benefit shown of spaying at that point for prevention of memory tumors. So spaying dogs and cats early is the main goal in preventing memory tumor development.
Okay, and how often, in order to check up on these animals to make sure that they are, or that they don't have cancer, or even if they do, how often should they get these checkups?
Yeah, so the key is early detection. Early detection can be done by owners just in petting their animals, and the earlier these tumors are detected, the better the outcome in many cases. Prognosis is directly related to the size of the tumor. So if a tumor is detected early, many times it can be removed and not cause long-term health risk to the pet. That's particularly true with dogs. About 50% of memory tumors in dogs are benign, The other 50 are considered malignant. And of those 50% that are malignant, only 50% of those would require some treatment beyond surgery. But early detection of these mammary tumors is really important in saving pets' life.
Okay, and is there any advice you'd like to give any pet owners on just being aware of this in general?
Yeah, I think the important thing is knowing the overall health condition of your pet, and understanding the risk factors, that if they were not spayed at an early age, that we need to be more diligent to check them for the development of these tumors. And at first sign or first concern of finding these in your pet, have them seen by your veterinarian, and they can make recommendations as to the best way to proceed with treatment.